Learn about programs and services offered by the Cape May County Health Department to keep you healthy and safe next on the Cape May County Report. Welcome to the Cape May County Report. I'm Lenora Bonafonte, Cape May County Communications Director, along with Mary Pat Hastings, who's the Director of Public Health Nursing for the Cape May County Health Department, and Dick Colosi, who's our Public Health Educator. Thank you for joining me today.
Thank you for having us.
Throughout the year, we think about staying healthy and safe, and maybe people don't think about their health department as a source to start that. And you have the Public Health Nursing Division. Tell us about that division of the health department and some of the programs and services that you offer to keep our residents healthy.
We have several programs. Many people are very surprised at all the programs that we offer the public. One of the programs that we have that we get state funding through and federal funding through is the Cancer Education Early Detection Program. And this is really for people that fall through the cracks. They're uninsured, but they're not poor enough to receive certain funding, but they meet a certain criteria. And this provides them with screening for breast, cervical, prostate, and colon rectal cancer.
Now, last month was Breast Cancer Survivor Day, and you used that opportunity to draw awareness to breast cancer and other forms of cancer in Cape May County. Tell us about some of the awareness programs.
Well, as you said, May was a Breast Cancer Survivor Day. That is actually May 20th. It was designated a couple of years ago by the then Governor Colosi. And what we decided to do was to do something that would be out in the community so people would be aware of the program and what it offered. And one of the things we did in the beginning of May was we had a breast cancer awareness walk, and we invited survivors, their families, friends, and anybody else in the community that wanted to come out and support the effort. And we had it at our lovely Cape May County Park and Zoo. And for our first effort, it was very good. We had 50 participants. Then toward the end of the month, we had our third Pink Tea, and that again is to celebrate those people that have survived breast cancer and to make people aware of their triumph.
Now, why are programs that promote cancer awareness important throughout the year, not just during the month of May?
Because we don't think about it. You know, we go on our daily lives, and unless something affects a family member or yourself, you tend to put, well, I'll go get my mammogram in a couple of months, when you really should be following the regulations and suggestions of your doctor, that you, depending on what your age is, that you get it, whatever your family history is. So that's why we want to bring that to the forefront, to make people aware that they really do need to get themselves screened, because if we find something at an early stage, it is much more easier to obviously diagnose it and then to treat it. And the survival rate isn't much improved.
Now, of course, you know, in these tough economic times, some people put off taking care of themselves and going for tests. They may not be able to afford it. They may not have medical insurance. How does a program such as SEED help those in need in Cape May County, and how can it avail them to screenings that they may not have the opportunity to have?
We do have many of our patients who've never been, you know, without insurance, and they're a little, number one, embarrassed, which should not be reason to not come. And there is a criteria, so it's not that you can be making a couple of $100,000 and just because you don't have insurance be eligible for the program.
What is the criteria?
The criteria is 250% above the poverty level. So it is fairly lenient. So it depends on how many people are in the household and you know, how much take home they have. We have a lot of people that are seasonal workers, so they may make a lot of money in one part of the season, but they don't the remainder of the season.
So tell us about some of the clinics that are offered that people can come to. Aside
from the SEED program, which is for women 40 and above and men 50 and above for the prostate, and in the Black community, because they have a higher incidence and an earlier onset, we do it at an earlier age. The other programs that we have are for...
Well, it's important, as you said, for men to get screened and tested as well when you talked about prostate cancer, and even for breast cancer, that sometimes there's a myth that men shouldn't get tested.
there's some research out now that sort of discredits what we've been doing, you know, the last couple of years, but we're still keeping the same criteria until we're told otherwise, which is to do the PSA testing on males above the age of 40 in the black community and 50 in the white community.
Now, where do the screenings take place?
We conduct our clinics at the health department. We have staff there. We have a nurse practitioner that conducts the female exams, and we have Dr. Kimmel, who's in our Cape May County, and he is a urologist, and he conducts the male clinics once a month. The female clinics are usually 2 to 3 times a month. The males is the once a month. And it's a general exam, GYN exam, breast exam for the women, and then whatever follow-up is needed, whether they require a mammogram at that time, their pap smear is done if it's required at that time, and then the program does follow the woman in the event that anything does occur, there is a suspicion. It covers follow-up X-ray mammograms. And then if they do require to see a surgeon, we have contracts with surgeons in the area for them to get further evaluated. And then once, if unfortunately cancer is diagnosed, then we can put them on what's called presumptive eligibility for Medicaid, and then they can get all their treatment and radiation and chemo under that.
Now, there are screenings and different types of clinics held throughout the year. And if someone would like more information about the screenings and the different clinics, they can visit your website at cmchealth.net and find out the particular clinic that they may want to attend. Also, when you looked at the services that you provide, we could really break them down in programs you provide for the young, the teenagers, and the elderly, since Cape May County does have a large senior citizen population. So let's take a look at the families. What type of services does the health department provide for our families?
We have family planning initially, and that is for anyone, you know, 13, 14 to 18 and up. That is under what we call Title X regulations, so it's private, they do not need parental consent, and it's free for those 18 and under. The other program, the other people that participate in the program, there is a sliding scale judged by financial criteria. And that is, it's a full exam, treatment if the need be, contraception, education, and any other general, like if they need a medical home, they just come to the family planning clinic, but they really need to see a physician, we try to refer them to where they can receive care.
So it can also be a place to start if you're looking for information, looking for education, and don't know where to begin. Right. The health department is a great resource for that.
And one of our challenges has to do with the men and getting them in for the exams that they should have. The prostate exam is something that is important, yet we seem to not get the response we want, because I think there's a reluctance on men's part to come in and get this exam. And that's too bad, because it's prostate cancer is a very preventable kind of cancer. It's a very treatable kind of cancer once it's discovered. So men should be encouraged, and I'm going to appeal to the women out there to encourage their men to come in and get this exam.
So as a health educator, and you go out into the community and talk to different groups about the programs and services that the health department offers, what are some of the things that you focus on? We were talking about families. What are some of the things that you encourage families to come and learn more about at the health department?
Well, there are many different aspects of learning in the health department with regards to family planning and just keeping oneself healthy. But I think one of the things that we look at in particular in Cape May County is the senior population. And we have a number of programs that are geared towards seniors, because we have so many people over 60. In fact, I think it's statistically shown.
We're tied with Ocean City for the largest percentage of senior citizens.
Exactly. So with all these seniors living in Cape May County, it's important that we get out there and try and help them. So we have a program called Healthies, in which we have different topics that we can bring to the community. We actually go out into the community and talk to the people about things like bone density, fall prevention, medication usage, and things like memory retention, because people think that because they get older, these things are inevitable. But what we've learned is that these things are not a result of aging, like loss of memory, but a result of lifestyle changes. And we found out that if you work on some of these techniques that we teach the senior population, a lot of these aging problems can be offset or prevented even in many cases.
So a lot of it is information that our seniors really want to know and need to know, and sometimes they don't know where the source is. So you go out and reach out to the community and you to tell them about some of the things that are of concern to them, such as bone health, how to keep their bones healthy.
Great. Yeah, what we do is we go out to the community. And in other words, if there's an interest in having this information, we'll come to them. We'll talk to a group and talk to them about how they can help themselves better in preventing falls, in dealing with, offsetting bone thinning and as we grow older, and to help themselves with regards to things like memory retention, because one of the things that's assumed when we grow older is that our memory grows weak. Well, that's not true. We remember just as well as we grow older. It's just that we have so much information in our minds as we grow older. It's kind of like a, if I could use the analogy, it's kind of like a computer disk that's filled up with stuff and can't get it all organized. We can do things that we can help our seniors better organize that information.
Well, some of the things that kind of cross over generations from our seniors that also help our youngers is the importance of exercise and keeping fit and good nutrition. So what are some tips you can give us about that you would tell the public?
Well, I think that exercise is important at any age. It doesn't matter if you're 8, 80, whatever your age, some form of exercise is absolutely essential. And you can gear your exercise to your age, what you're capable of doing. So exercise is very, very important, and it's very important to try and exercise a little bit each and every day. And if it's just walking up and down a couple flights of steps, walking down the hall, sitting in your chair and lifting a couple cans of soup, it's all important, and it is exercise.
So it's choose to be active, choose to do something.
Choose to be active and plan to be active.
Now, Mary Pat, from a nursing background, good nutrition is important. We said that. What are some of the things that people should know, like to stay healthy?
Well, one of the important things, and that's what we gear one of our clinics for, is vaccination, and especially childhood vaccination. But there are other vaccinations that are across the age line, which you need as you get older too. But I'm going to just talk a little bit about the things that we have for the family, which is we have a child wellness clinic, and again, that is a sliding scale fee. It's minimal. You have to have an appointment. It's once a month, and they will, the nurse will and the doctor will go over the vaccination status, what has to be updated, what doesn't, what you need. And then also, if they find any medical condition, again, as we said about referring somebody to a medical home if needed. We also have early child intervention services, which is conducted at the health department, but it goes out into the community. They have to interview the families out in the community, and they have a central referral site that telephones in the prospective client, and a nurse and the team goes out to the family and evaluates the child and determines what services are needed. We also have special child health services, which is a nurse that helps navigate families that have special needs children or child through the the red tape of trying to get different programs and referrals and where you can get resources. So she really is an advocate and as well as navigates them through that process.
So we go from early childhood all the way through. We're going to take a break, and when we come back, we'll find out about more of the programs that the health department offers in Cape May County to keep you healthy and safe. So please stay with us.
How far would you go to feel young again? How far to capture the sun? To walk in the wild? To celebrate new traditions? How far would you go to just slow things down? Your journey begins at njsouthernshore.com, New Jersey's Southern Shore region.
How far would you go to build a kingdom? How far to save a species? To shoot the rapids? To bolt at the speed of lightning? How far would you go to live in another century? To share new discoveries? To make the summer last forever? Your journey begins at njsouthernshore.com, New Jersey's Southern Shore region.
Welcome back to the Cape May County Report. I'm Lenora Bonafonte, Cape May County Communications Director, and we're talking about the Cape May County Health Department and the services and programs that it provides for you in Cape May County. And with me is Mary Pat Hastings, who's the Director of Public Health Nursing for the Cape May County Health Department, and Dick Colosi, who's our public health educator. Before the break, we talked about a number of things, but one of the issues that came up was our large senior citizen population in Cape May County. And the Cape May County Health Department has a number of programs that service our seniors in Cape May County. Senior wellness is important. Tell us about senior wellness programs.
The senior wellness program we started last summer. We sort of had a kickoff, tried it in a couple of the different senior centers in the county, and we had a good response, and then we moved it to the health department, and we didn't have as good as a response. We did have people come. It was by appointment. It was once a month, and we did it from like 9 in the morning to 12 because we also offered not only blood pressure screening, but we offered screening for diabetes, high cholesterol, and their blood hemoglobin, because a lot of seniors unknowingly are anemic. So that was blood screenings that we did. We did a memory test. We did a Tenetti score, which is, Dick alluded to it, it's for evaluating a person's gait and if they have the risk for fall. We had a med management program where a nurse sat down with the patient, had them bring all their pills in and go through and make sure that they didn't have, you know, pills from one pharmacy, pills from another pharmacy that might interact with one another. We had somebody do nutrition. You mentioned nutrition before and how important it is. And many of our seniors, you know, don't eat right because they might be living alone. They eat fast foods or early bird specials and then eat too much. So, you know, we had somebody sit down with them and talk about good nutrition. We also evaluated their vaccine schedules to make sure that they've up to date with a tetanus shot, that they get their flu shot every year, that they had their pneumonia shot, whether they were had Zostavax, which is for shingles, and educated them about that too.
So it's a well-rounded program that really encompasses everything that a senior may need to know about staying healthy. One of the things that stands out for some of the things that would be something that everybody could use, when you talk about the screenings, they're not just for seniors, but it's important that everyone gets screened for diabetes and different types of screenings. Why are those screenings important?
Because some of those diseases are very insidious where they don't show signs and symptoms right away, and you might be walking around with a blood sugar and not realize that your blood sugar is a little above normal, or your cholesterol is out of whack totally because you feel perfectly fine. Your blood pressure, again, that's a silent killer. People walk around with blood pressures of, you know, 170, 190, over 100, and they don't even know it. So
really a lot of these things can be considered preventive measures. Let's get healthy so we avoid disease, we avoid sickness, and there's some of the programs that the health department can help with. You've talked about the screenings. You mentioned about seniors getting flu shots and getting pneumonia shots, but one of the most successful programs that I think the Cape May County Health Department offers is the free flu vaccine, which the Cape May County Board of Chosen Freeholders have sponsored and supported through the years. Tell us about the fall flu shot program and how important that is to get your flu shots.
Well, we certainly advocate that everybody get a flu shot. The more people that get a flu shot, the better protected our community is, and especially the vulnerable part of our community that can't get a flu shot for whatever reason. We do offer several clinics. We offer parent clinic, family clinic, employee clinic. We have the drive-through flu clinic. We have the high dose, which is now recommended for seniors 65 and older. So we're really out there pushing that people get the flu shot, because the more we can contain the flu, the healthier our community is. And this year, whether it was the weather or anything else, we had a very, very mild flu season.
Well, you know, a lot of this all encompasses taking control of your health. So if you were going to talk to somebody about how they can take control of their health and some of the measures they should take, tell us about
Well, we have
that.
a wonderful opportunity for seniors and with regards to taking control of health. That's a program we have. It's actually called Taking Control of Your Health. And this was a program that was developed by Stanford University. It's an evidence-based program that we go out in the community and give in churches and community centers and civic association groups, wherever people would like us to go. And it's 6 sessions, about 2 hours each, and we talk about things like pain management, fatigue, isolation, all these things that affect people as they grow older. We deal with flexibility and endurance programs. And we talk about things like communication skills, how to better communicate. Communicating through I messages as opposed to you messages, a better way of opening up people and being able to tell people. And also, finally, we talk about making better treatment decisions as far as their own treatment. The best patient is an aware patient, someone who is not afraid to speak up and take control of their health by saying what's on their mind about what's happening to their body.
So give them tools so they can advocate for
Absolutely,
themselves.
that's what this is all about. It's about tools. Tools that they can take with them, and we've actually seen people improve. We've had people come in, taking this course, be on oxygen when they started, and come off of oxygen, at least for some of the time. People who have been in walkers, who don't use walkers as much anymore, at the end of this course. I see people who have taken this course and months and months later and say, I'm still doing my action plans regarding this course, and it's showing a great difference.
Now, do you put an age to this course, or can anyone come to this
Anyone
course?
can come. We do not put an age for it. But we try and keep the classes small, 12, 15 people.
Now, do you have classes on a regular basis, or if a community group would like you to come to them and do this course, how can they contact you?
They can call me at the health department, and my number is 463-6521. Or they can call my associate at Cape Regional Medical Center, Bonnie Kratzer, and her number is 463-4043.
And then the program actually will go out to the community.
We go out to the community on a needs basis.
Now, of course, we're right as summer season is upon us. We're getting ready to kick off summer, and with tourism being the #1 industry in Cape May County, and we're so happy for people to enjoy our beaches and all that Cape May County has to offer. But we also want them to be safe while they're here. So let's talk a little bit about some safety tips and things to do to keep you safety while here in Cape May County. And I guess one of the things that people do first when they come to the shore is they want to go see the ocean and go to the beach. And how can you stay safe when you're going into the water?
Well, I think that they have to be aware of the water, and they have to try and be cautious. That we want everybody to have a good time. We had a glorious, wonderful Memorial Day weekend. There were many, many people at the beach, and we want all those people to be safe. But we want them to be sensitive to what the ocean is. The ocean is filled with different obstacles that can be dangerous, and also filled with something called rip currents. They occur now and then. Now, a rip current is something that happens in the ocean where it takes someone out. But there are ways in which people can deal with rip currents by staying calm, letting the water pull them out, but not worrying about that. Stay calm, and then swim parallel to the beach. When they swim parallel to the beach, then they can swim back in safely. But don't try and fight the rip current swimming directly against it. We want people to swim in safe areas. It's always good to swim near a lifeguard at a protected beach. We have found that that's the best thing, and there are very, very few problems when you swim near a lifeguard, and if anything happens, there's someone there to help.
And in all our municipalities that have beaches, there are all protected beaches, so it's easy to find a beach that is protected and stay safe. And of course, hurricane season started in June, and it runs through to November, so we just want them to be aware of the changes in the weather and how they affect the ocean. And
another thing that we need to be cautious about is some of the beaches have been replenished and there's a drop-off. And lots of times people aren't aware of those waves that come crashing in. So when you enter or exit the water, be aware of the surf and what those waves are doing so that you get in and out of the water safely. And
we know that we all enjoy sitting on the beach and getting some sun, and I know that's one of my favorite things, but we have to be careful and be wise about how we go about it. And you have an event that you put together each year now that takes place in July about Choose Your Cover, and it helps and tells people what they should be looking for for cancer screenings. Tell us about the Choose Your Cover
Well, everybody
event.
should use some sort of sun safety protection, some sort of sunscreen, and an SPF or a sun protection factor of 30 or more is useful. Some people say that too much is not, good, but I think using a high SPF is important. Nonetheless, Choose Your Cover is an event that we're having. It's going to be on July 14th. It'll be in the city of Cape May at the new convention center or convention hall. And Dr. Paolini, who's a certified board dermatologist, is offering free sun safety skin screenings. And that'll go from 11 a.m. until 2 p.m. and we'll be handing out information about sun safety. So if you're interested in that, all you have to do is be there. Be there between 11 and 2. There's no appointment necessary. Just show up at the convention center right on Beach Drive in Cape May.
Now, one of the other things that when you're here at the shore or anywhere this time of the year, especially when it's damp or there's still water, we have to worry about those pesky mosquitoes. They come around, and the health department does a lot throughout the summer to help with that and testing for West Nile virus. Briefly tell us about that program and how we're trying to keep the pest control down in Cape May County.
The health department works in conjunction with the Mosquito Control Commission, and surveillance is done to make sure that there are no standing water, that we don't see the large, like clusters of birds, dead birds, especially crows and blue jays. And if somebody does see a large amount around their neighborhood or whatever, that they should notify the health department or the Mosquito Commission, because that may indicate that there is West Nile in the area. So what you can do as a community resident is to make sure in your area that you don't have any still water, that you empty out pool covers and pots, planted pot drains, and all of that kind of thing that where it would accumulate and you could end up with a mosquito pool.
So there's so much information as we're learning that you can learn from the Cape May County Health Department. You can find out more at cmchealth.net. Until next time, I'm Lenora Bonafonte. See you on the Cape May County Report. Thank you for joining us.